Hi, my name is Harland Holman. I'm the Family Medicine Clerkship Director at MSU, and I see patients out of Corewell. Frank, how about you? Can you introduce yourself?
Yes. My name is Frank Muller. I'm a health services researcher, primary care physician, based at Michigan State, but also in a university in Germany. Adjunct professor to the Department of Family Medicine at MSU. Yeah, doing a bunch of research.
So, Frank, we worked together when you did research in Grand Rapids, and I believe you were the one that had the idea of loneliness in family medicine. How did you first come about that?
Well, I'd say from a patient perspective, right? There were a bunch of papers coming out at that time on the impact that loneliness and social isolation has on patients, like regarding various outcomes, dementia, heart health, and so on and so on. But I ask myself, we as a profession and as family medicine providers, how is our perception of loneliness and social isolation?
And I thought that, topic definitely hit home to me because I experienced it in different offices I've been at that we can, work with people all day trying to help them, but like professionally, even though we have other family doctors are in our same office, like we don't talk to them all day long, and it sometimes feels a little bit lonely. Have you experienced that in Germany as well?
Yeah, sort of, especially in single offices or where just two providers work together. Um, yeah, but I think kind of for me, what's striking me is that it's counterintuitive because I would assume that family physicians, what they do all day long is talking to patients. I couldn't imagine a specialty where you have so much patient contact, like time-wise and also in numbers of patients, right? And you're talking to them. So how can one ever feel lonely in these situations? But yeah, but from a certain perspective, it kind of makes sense because eventually you're kind of on the giving side. You're giving attention. You're giving um, your perspectives. You're moderating things, but no one is looking after you, right?
Right.
Um, yeah, I'm kind
And
of interested how you see that.
yeah, and I think kind of moving a little bit onto the research side, like when we started having these questions, we realized that Society for Teachers and Family Medicine had that SERA survey that asks that we could come up with questions and send it out to family doctors across the country. And I think at first we started thinking, how are providers treating their patients with loneliness? Because that is a new epidemic. Our Surgeon General mentioned it before, and it's not a topic that we've trained a lot about. And then I think we realized it would be interesting to see how physicians actually rated their own loneliness. So we found that three-question UCLA scale that was pretty simple to add to the national survey.